Hi everybody, this is Dr. Ihab Abdurrahman Ihab Tarawa, consultant of acute care medicine at Soba University Hospital, professor of medicine, University of Khartoum. Still doing our course, medication safety course, introduction to medication without harm, reflecting on the third patient safety challenge, medication without harm. In this session, we are going to discuss high risk situations. The objectives to describe high-risk situations, to discuss medication harm in high-risk situation, and to execute measures to reduce harm in high-risk situations. High-risk situations are important because they are more often associated with significant harm due to unsafe medication practice or medication errors. I would like to emphasize that all errors that happen in ordinary situation can happen in high risk situation, and they can happen in more frequency. So those like omission, commissioning error, wrong dose, wrong formulation, wrong patient, wrong route, all these are more likely to occur in high risk situation, plus the specific characteristic of high risk situation. There are main factors, the three main factors contributing to high risk situation, some of them related to the medication factors, individuals, which are provider and patient factors, plus system or environmental factors. Medication factor includes the use of high risk or what we call high alert medications. These are medication with low therapeutic index, which mean that the low ratio of maximally tolerated dose of the medication to the minimum curative or effective dose. These like digoxin, thiophyllin, this medication with narrow therapeutic window. Adverse drug reaction are traditionally classified into two categories. Those with high risk of type A or augmented reaction, normally a dose-related augmentation of non-pharmacological effect of the medication, like digoxin, thiophyllin, lithium. These are drugs with low therapeutic index. Those with high risk type B or bizarre reaction, sometimes termed idiosyncratic, for which the effect often unpredictable, and sometimes like allergic reaction, not related to non-pharmacological property of the medication. These are important because you need to ask about history of allergy, and the subsequent allergy sometimes become very severe and even fatal, like penicillin, which can start from itching to hive and progress to anaphylaxis. Example of high-risk medication, anti-infective like amphotericin, aminoglycoside, high concentrated electrolyte, especially potassium when we are using high concentration, or hypertonic saline. These are high-risk medication, special care and precaution needed. Insulin, because of the variability and different form, and sometimes people use ordinary syringe instead of insulin syringe, and some people use regular instead of the intermediate or long acting. Narcotic and sedative, and these can have cumulative effect, and also there is challenges when we change from one formulation to another. And when we use this medication in combination plus some of those narcotic and benzodiazepine plus some psychiatric medication, especially in those who drink alcohol, the risk of toxicity is high. Chemotherapeutic agents, these need special precaution, and there are a lot of tragedy reported with vincristine, sometimes given intrathecally and leading to death. Methotrexate used in rheumatoid arthritis and other inflammatory condition. Sometimes people use toxic dose. The regular dose is 20 milligrams. Some people, they go to 10 milligram daily or other toxic dose. Heparin and anticoagulant like warfarin and new anticoagulant, these medication need to make sure they are used for proper medication, and there is difference between prophylactic and therapeutic dose, and they need significant monitoring. Other medications is like non-steroidal anti-inflammatory, especially for those with peptic ulcer disease. Paracetamol, sometimes toxic dose can be achieved easily, especially in children. Lithium needs special medication, and medications that can cause allergies. Allergy to medication can cause high-risk situation when used in error. Medication causing allergic reaction are not necessarily considered as high-risk alert condition. So if the patient has an allergy, whenever you are in doubt or you want to challenge a patient, special precaution is needed. For example, those with syphilis, when you try to treat them with penicillin, here special precaution, special sensitization can be done, and this should be done in the intensive care unit. One example of this allergy to antibiotic like that for penicillin, beta-lactam. The most severe allergic reaction to penicillin is anaphylaxis. It killed 500 to 1,000 individuals in the United States per year. Unfortunately, individuals who have previously experienced a rapid onset allergic reaction in relation to a medication may be given the same again, and sometimes fatality can occur. Provider and patient factor, these for the provider, over prescribing, under prescribing, misprescribing. Over prescribing occur when medication is prescribed whose risk of harm exceed its likely benefit in particular individual, while under prescribing occur when medication is not prescribed whose likely benefit greatly exceeds the risk of harm, while misprescribing occur when either wrong medication or is prescribed, or wrong dose, wrong frequency, or duration are administered. Patient factor for high-risk situation, these are those with frailty, those on polypharmacy, 5 medication or more, those with multiple morbidity, because sometimes the medication metabolism and excretion depend on the liver and kidney. And in addition, the harm of some of these medication combination may sometimes be synergistic and be greater than the sum of the risk of the individual agent. The very young and the very old sometimes are more susceptible because they lose their physiological reserve to compensate. Medication error in children, where doses are calculated according to the weight, can lead to high risk situation. System factor depend on the environmental factor, including setting. Hospital are high risk, and inside the hospital, nursery, ICU, anesthesia are high risk situation. Generally, medication error are often caused by combination of medication factor, provider and patient factor, system factor. So a range of sustainable strategy of providing efficacy should be developed and implemented in conjunction. So strategy to reduce harm from high risk or high alert medication. One of them is to play and do failure mode effect analysis, proactively identify risk and how they can be minimized. Error-proof design, forcing function and fail-safe, built-in safeguard to prevent or respond to failure. Limit access or use some constraint, like for example narcotic. To use them you need special or extra steps, or concentrated electrolyte, you need to do a forcing action and you keep them in the pharmacy rather in the floor. Maximizing access to information, give the provider, doctor, nurses, and pharmacists resources, online or physical resources, so they can check and review medication and make it easy for them to use. Constraint and barrier, use special equipment or work environmental conditions to prevent hazards from reaching the patient. For example, when we are using oral medication is a syringe, we can use a syringe that does not fit on the IV axis. This is constraint. Standardize create clinically sound, uniform model of care or product to reduce variation in complexity, standardize, simplify the process and steps, and improve the handoff. Centralized error-prone process like mixing the or reconstituting IV solution is better. You take this step to the pharmacy, and also we need to be prepared whenever error happen. For example, those who took overdose of narcotic, we should have naloxone available, and those who took sedative or benzodiazepine, we should have flumazenil and antidote available. Special care is needed. Collaboration between doctor, pharmacist, nurse, and patient are needed, and this happen in every steps. So partnership is important. Decide first for the doctor, decide if prescription is indicated or not, or if there is another alternative, and make sure you are prescribing for the right patient, appropriate medicine, appropriate dose, appropriate route, and appropriate duration. When the pharmacist gets the prescription, he or she should review that, make sure it is for the right patient, and that is the right medication on the right dose and route, right duration, labeling, and right storage condition, and give educational material to the nurse and to the patient. Also, the nurse make sure this medication are related to the appropriate indication, and she reviewed that, and she makes sure it is the right patient, right medication, right dose, right dose, and frequency. And the same thing for the patient, he should be educated and learn about his medication. One of the high-risk situations is look-alike and sound-alike LASA, and these we should pay extra attention when we are prescribing, transcribing, procuring, storing, or dispensing. Certain medical condition predispose patient to an increased risk of adverse drug reaction, particularly those with renal disease, hepatic disease, or cardiovascular disease. We have to be aware of this situation, and when the patient is dependent on the kidney or the liver, we make sure the liver function and kidney function are checked and should be followed while the patient on medication, maybe every 6 months or according to the indication. Other strategy to reduce medication error related to provider and patient factor. We know that as mentioned by James Reason, has noted that there should be a system approach to counter the effect of human fallibility. This approach concentrates on the condition under which people work to build the defense required to avert error or limiting their occurrence. So you have to design a system that forces the people to do the right things and make it difficult for them to do the wrong thing. When you put the concentrated medication in the pharmacy, and when you have forcing intervention, you make it a little bit harder to do the wrong thing. Clinical human factor group has identified 4 major themes when we design the system, when we build the team and we establish team dynamic and communication. Whenever there is incident investigation, we have to analyze that and figure out the contribution of the system and human factor on that and redesign the system accordingly. And we have to design the working condition, or even when simulation is done, that it should match the real working environment. For provider, capacity building is important. We have to teach the student, the junior and frontline provider, and how to prescribe appropriately. And also they need to know to take good medication history about prescribed, non-prescribed medication, and they should establish history of allergy and should write it in a very clear, accessible site of the chart, and they should do medication reconciliation any point of transition of care, when patient admitted, transfer from one unit to another, or discharge, or when provider is prescribing new medication, should review the medication reconciliation. And we have to do routine medication review, especially on those on polypharmacy. We have to work on the system factor, reduce interruption. We should have noise free area without interruption when we are prescribing, administering medication. Preparation and administering intravenous solution are more prone to error. If we can move the reconstitution to the pharmacy, we can implement the forcing step and reduce the risk of doing wrong here. The provision of pre-prepared injection may reduce the overall error rate significantly. Chart design should be looked for. Electronic prescribing can help, and also we should have access to high quality information. Patient should be educated, should be partner, should be taught about 5 moments of medication safety whenever he start a new medication, taking any medication, adding a new medication, reviewing his medication, stop any medication. He should ask about the indication and how to use the formulation and what to do in case if he miss a dose, and should be able to access support from the health system whenever needed. Take home, high risk situation can be related to medication, provider, patient, and system factors. Awareness of high risk medication can help to implement extra care. Patient factors include extreme age, polypharmacy, and multimorbidity. Some situation like in hospital and anesthesia, patients should be engaged and educated and empowered for 5 moments of medication safety. Provider factor can be mitigated by utilizing of human factor in system design, improving capacity building, and by providing resources for information and utilizing medication reconciliation and medication review. System design based on human factor can help to reduce factor related to the system. Thank you, and see you in the next session.